Hello, All-Star listeners, and welcome to another episode of the Veterinary Roundtable, presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice, and if you have any feedback to offer to improve the Veterinary Roundtable, please let us know.
Have we even gotten any feedback? We haven't gotten any feedback, so be the first to give us feedback, and you'll get a prize. Per Harrison. On today's episode, we have myself, co-host and associate veterinarian Dr. Ashlyn Duckwall, head of surgery Allie Cook, surgery technician Becca Kenny, and our head honcho, the head veterinarian of All-Star, and my co-host Dr. Emily King. Welcome.
Congratulations for being here.
Yes.
Yay. I will say my last name is McQuarrie now.
Oh, it is.
Oh, and I stuttered on Kenny because
Yeah,
I don't
she-
call
I know,
her
I just
Kenny.
call her
I
Becca
totally
Fidel
heard that.
all
It was
the
like
time.
Becca Kenny.
Yeah.
Yes.
I want to say Fidel.
It's all right.
I didn't even notice Allie's not being on there.
It's okay. You said it so flawlessly.
I still haven't changed it on both Sarah.
I can't. Now you would be like APM. It
Yeah.
doesn't work. It's just
It
not
doesn't
the
work.
same.
I
No.
still go by APC. It just,
APC.
you know.
It
Yeah.
flows better.
It's just
no
like
one
got a
calls
ring
me
to
Kenny.
it.
Literally no one. And I'm like, it's fine. Like, you don't have to call me Kenny.
Yeah.
Okay.
Besides,
We are big
cooler
last name
anyways.
goers.
We
here,
are.
So it kind
It's
of is
like
a big deal.
really-
I don't think I
It's-
call
we've
any
kept
of the
it-
doctors by their first names.
No.
Ever.
We called
Too
everybody
weird.
by their last names. We started a
Yeah.
trend and it's just stuck to it.
This makes sense.
Yeah.
It'd be weird to use first names.
Gosh. Well, we're glad you guys are here.
Yeah. You guys doing okay?
Yeah.
Yeah.
Not too hungry?
No.
Angry and hungry? That's good.
No, I had a little snack.
Oh,
So I'm
snack.
good.
Snackaroo.
There's some leftover candy in the kitchen,
Yeah, there's
too
too much. We just need to throw it away because I'll eat it all.
I brought in a tub, a cauldron of candy.
So don't say a
Why?
tub. You brought in
Yeah.
a big old ball.
A cauldron. It's put
So
away for later
unnecessary.
so we can pull it out and throw
Nice.
it when people need their chocolate fix
That actually
we
is
need
big.
a pinata.
in November.
Yeah.
Yes, a
good.
pinata would be very cool.
You know what also was great is when we had that snack cart. And
That
it was
was
just
nice.
like,
I think
here,
I
no
was just, like,
reason
stuffing
needed.
stuff in my pockets.
Yeah.
Because I was so
It was great. It's something that
We need
You're like a
those-
squirrel.
Yeah. We need the beef sticks back. Those were so good, man.
Beef sticks. Okay, I'll
You
remember
laugh,
that.
but they're good.
They're so
Yeah.
good.
I just went to the Sam's Club and got me some.
Beef sticks.
Some beef sticks.
They're so good.
Beef jerky.
Oh, goodness.
like
Oh,
food.
yeah, we need to mention the rug.
if
Yeah.
people
Rug.
watch our podcast, they would notice we have a new
rug.
rug. It's actually very bright.
Where'd you get it? Amazon.
Amazon.
Oh, but I got
Another
mine on
Amazon.
Amazon too.
Another Amazon purchase.
Nice.
Love some Amazon.
Amazon will take over the world.
They already have, I'm pretty sure.
That's true.
And I unfortunately allow it because I think I have an Amazon delivery like every other day.
Yeah.
It's hard not to.
Convenient.
It's just so convenient.
It is so convenient, especially when you're like, I mean, I don't have time to go out and shop. Oh, just shop online. And Prime? Who doesn't love Prime?
Yep.
It's the first thing I think of. I'm like, oh, I need this. Amazon.
Yep.
Yeah, no, that's true.
I've saved countless hours.
I mean,
Yeah. Time,
frickin' Harrison got the
money.
spicy chip on Amazon. Oh, we're never
Oh,
doing
yeah.
that again.
Yeah, that's
They
a
have a
little
new
sketchy.
chip, by the way.
They have a
there's
new
one.
chip.
There's another one, yeah. It's blue now.
Ew.
Oh.
Is it
Not
I-
spicy or something else?
Oh, no, it's still really spicy. And
No
it's put,
thanks.
apparently it's put multiple people in the hospital.
Oh my gosh.
Yeah, it's so stupid.
They're eating the whole thing.
Harrison's
no,
over,
yeah, they're
Harrison's
literally
over there like, oh yeah, we got to do
No.
this.
Oh my
They're
gosh.
shoving the
that's-
whole thing in their mouth and eating it, and I guess it's like they like go through stages,
Ew.
and then you end up in the hospital.
No good.
That's
no way.
just stupid.
It's so stupid. It's like the Tide
Over a
Pod
chip.
thing.
Yeah. Yeah.
Oh dear God.
Kids,
Kids.
People eating Tide Pods.
Good
That
lord.
doesn't even sound appetizing.
I agree. Like, oh, yeah.
I gotta say, sometimes the liquid, like in the little pouch, like
No.
looks like a sour.
No.
Like it would like.
Oh,
Oh.
my gosh.
like one of
No,
those fruit,
You would say
those
that.
those fruit bursts or whatever,
Yeah,
or the
gushers.
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 Yeah.
You
You ever
exactly.
had soap in your mouth as a child?
Oh, all the time. Are you
Okay.
surprised?
No.
No, but
Oh, fun fact: my mom used to use vinegar, and I actually, fun fact, loved vinegar, like vinegar, salt, and vinegar chips. And one time she put a spoonful of vinegar in my mouth, and I looked at her and I went, tastes good.
Oh,
And
no.
she was like, "Ah!" Just lost it.
Uh-oh. That's not good.
spanking.
Yeah, that's
Naughty
right.
That was
Becca.
bad.
Oh my god.
I don't know why I did that because I didn't mind vinegar, so why would I? But I was
Yeah, you
just
gave up
being
that.
a sassy child per usual.
Oh, well. sassy
Wow. Didn't see that one coming.
Not at all.
child. You're still sassy adult, Becca.
That's right.
Yes, this is very true.
Apparently, we need to mention why we have Allie on the podcast.
Yes. Yeah,
Yes.
because I mean, we got some like really good conversation
Yeah.
happening from
Yeah.
your information piece that you put out there.
That's awesome.
So good and bad.
Got a lot of
Yep.
responses.
I think that the topic probably is a hot button topic for a lot of people.
Yeah.
You know,
For sure.
So
It's a big gray area too because there's so many different situations that you can be put in. And a lot of those people I feel like are obviously in different situations, living in a different type of, financial culture. And so it's just,
and yeah, it's
Or culture in general.
or
at work.
Right,
location
yeah.
in the region of the
Yeah.
United States. I mean, like it could be totally different.
yeah.
Yeah. Differs from state to state.
I think that.
But we'll
anyway,
get
so-
there.
Yes.
Hold your thoughts.
Oh,
Yes.
Yeah.
So
Dun,
I,
dun, dun.
so we're going to get to that because
Oh, are
we
we
thought
doing
it
our-
deserved more conversation,
Yes.
more in-depth conversation than what TikTok can allow. So
And that's why we don't have an icebreaker today. Bummer. I love the icebreakers. I really love them. But it's
Yep.
okay. We'll just jump into case collections.
okay, who wants to go first? Case collections.
I'll go first. Mine's going to be short and sweet. It is about a little pitty named Bijou. She was found on the road somewhere, and her mom adopted her.
Downtown,
And
I
so,
believe. Downtown Indy.
Yes.
Seems like a regular story for a pit bull.
Yeah.
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 Unfortunately.
Yeah.
Found on the street.
No owner. Very sweet.
Okay, sorry.
But she came to us because it was suspected that she had abdominal mass, which we confirmed through ultrasound. So we found that it was a splenic mass. We went in, and the mass was actually like the size of a volleyball. We took it out.
We weighed it, right?
Yeah, it was 4 pounds.
4 pounds.
It was a hefty, and she's a small gal.
Yeah.
And it came back, and it was benign. So it was just a happy story. Also, it was the size of a volleyball, so that was cool.
And her mom is like the coolest owner ever, and she would do anything for her. And I could just picture her face finding out it was benign because I know she was so worried. I mean, she would she said on the phone she would do anything for her. So it was really, really cool because it definitely looked suspicious
Oh yeah.
when we took it out.
She's only 6, and she
yeah.
recovered pretty well.
So far, so good.
What are the risks if she didn't decide to take it out? What would usually happen?
It could rupture, definitely with the size.
Yeah. And
Ticking
then
time bomb,
Yeah.
they just essentially bleed out, which is really
Yeah.
sad. But
especially in a benign tumor. Like,
yeah, because it's 50-50. You don't know.
Right.
But
Yeah.
either way.
Very cool story. Yeah, that thing was intense. We had to like roll her body.
She
And
probably
yeah,
felt
to-
so
yeah.
good
To,
Oh
like,
my
pop it
gosh.
out.
Yeah.
Getting that out of there.
I know.
Yeah, that's got to
Yeah,
be nice.
Cloud was. Yeah, it was a cool procedure to watch.
Okay.
Very bloody, but cool.
Okay.
those pictures will not be going out.
No, unfortunately not.
Pretty
no.
gory.
Just Google it if you want to see it. I'm sure it's all over.
I'm sure.
Google.
Yeah, exactly.
Well, I'll go next. Oh, do you want to go?
No, go ahead.
Okay. Yours is cooler than mine.
Yeah,
so.
that's true. Yeah. it is.
I had a 5 or 6 year old big 90-pound mixed breed dog come in, and owners had been camping and they noticed that he had been playing around, gotten a hold of a stick. They didn't really go into detail about the size of the stick, how he was holding it. But then afterwards, he was just bleeding profusely from his mouth, drooling, didn't want to eat, very just uncomfortable in his mouth. So he came in and we just sedated him right away to get a good evaluation. And at first it was looking okay. I'm like, okay, maybe he just got a little poke. No. And the back of his mouth, right next to his airway, so where the dog's tonsils are, there was a huge tunnel, essentially. So what we can only assume is that whatever part of the stick he had a hold of jabbed to the back of his throat and made this just ginormous lesion. And it already looked infected, and it had only been 24 hours. It wasn't bleeding, thank goodness, but the gums bleed terribly. So I can only imagine their concern when that was happening. But he was just so uncomfortable before we even found it. And I did not end up closing it with sutures because it was already infected, and the gum heals very nice and very quickly. So I started him on antibiotics and anti-inflammatories. Turns out he's doing a lot better, feels great, and we're rechecking it tomorrow. No, 2 days from now, under sedation. But it was the biggest gash I've seen in a
It
mouth.
was gnarly.
It
Makes
was-
you-
I'm sad I missed this.
I've got
I wonder
videos
where
and
I was.
pictures if Harrison wants to post it, but
Yeah,
it was
I
right next to
definitely
the
wanna see those
airway. Like
pictures.
that would have been awful.
Yeah.
Yeah.
Just the luck.
Yeah.
I mean, I'm sure like the stick itself, the point of least, pressure or whatever. So fine, like it Oh, yeah.
Makes you think twice about a stick in your yard.
Yeah. Well, I mean, I think that they're notorious for carrying sticks, chewing on sticks. I mean, how many times have we found them in the roof of their mouths?
Yeah.
I mean, it is just
stinky mouth. Like, why does my dog's mouth stink? Well, it's because there's a stick been up there for
months. They're soft enough that they really like to chew on them and play with them, and then they just
I don't know what it is about them.
Yeah,
I thought it was his airway. That's how big it was.
Oh, that's really cool.
I thought when he was
Definitely
breathing,
gotta see
that's
pictures.
what it was.
Oh my gosh.
Yeah. So,
that was crazy.
but he's doing well. Good.
Yay! Fix it.
Yay!
That's awesome.
You want to go or do you want me to go?
You can go.
Okay. So last week, Dr. Jones had a 6-month-old bloodhound in for a routine spay. So what that involves is we go in and we take the uterus, the ovaries, and the uterine horns. Well, when we went to go make our incision, Dr. Jones had noticed that her uterine horn, the lining of it was extremely, extremely thin, like a lot thinner than this dog was. 60 pounds, 65 pounds. So the size of it was extremely abnormal, way too small than what it should be. It was like the size of a 5-pound cat. And so she was like, what is going on? And so we, called reinforcements. I think, did you come in?
Mm-hmm.
Yeah, it was Dr. Duckwall. I think Dr. McDivitt came in and we looked at it and I don't know who it was. I had jokingly, prior to all this, said that, oh my gosh, what if she's a hermaphrodite? And kidding, like completely joking, because there's like, I Googled it, it's like 0.1 to 0.5% chance of this happening, by the way. So Dr. Jones, of course, just laughed it off. And then you guys came in and Dr. McDivitt, I believe, is the one that noticed it was like a circular-like structure on one of the uterine horns. And what ended up being what we think, which we sent in the uterus, it's like the whole thing itself, a testicle. So right now, based off of our findings from what we saw during the surgery, is that she had both male and female reproductive parts. She had the uterine horns, she had the uterus, she had ovaries, and then she had a circular-like structure on each uterine horn that we think, at least for now, are testicles.
It was interesting.
So, like I said, we sent out the whole thing to pathology, so we're going to find out what they were. And she did great during the surgery. There was no complications or anything. We took everything out, closed her up, and I believe she's doing fine. But very, very cool, very interesting case that Dr. Jones has. So
what was interesting is when she was like showing us like the horn, it definitely looked skinny and thin, like not normal. But then when you got to that circular structure, there was like the muscle belly, like basically what attaches to the testicle when you neuter them. It's called the vaginal tunic. So there was a really thick muscle that looked exactly like what you would see when you neuter a dog. So that's what I think was also like, and then following the attachment from the supposed testicle was really thick band, and it was going down to where the testicle would usually descend.
That's what usually you guys yank on.
Exactly.
Yeah. It was.
It's fascinating.
I have pictures on my phone. I don't know I know TikTok is a little iffy about bloody pictures, but it was really, really cool to see that. So,
and she only had external genitalia, right? So only a vulva. So we had no idea.
Yeah, she had female external genitalia.
Yeah.
But yeah, it was.
That
pretty...
histopath is going to be cool.
Yeah,
everyone's going to be, like, wait, did you check already to see if it was back? It's not back yet.
So so she's, but like I said, mom, and of course her owner is a nurse, so she had all these sorts of these questions, and we were able to send her pictures because she was okay with us sending pictures, and but yeah, pretty interesting, pretty cool.
Very cool case.
Yeah.
Well, keeping in that same theme, my case is like an 11-year-old small breed dog that came in for swelling in his inguinal area. He was dropped off at the owner's house, actually her parents' house. And so her parents are older, couldn't take care of him. And so they gave him to her when he was a younger dog. And so, as far as she knew, he was neutered because he did not have any testicles in his scrotal sac. So long story short, he comes in over the past 6 months. We've been monitoring this area in his inguinal area. He's a dog that's had back surgery and some other abdominal surgery and has some hardware in some places. And so we were thinking that his inguinal lymph nodes were maybe just reactive because he had a swelling on each side, but one was a little bit bigger than the other side. So we were assuming these were inguinal lymph nodes. and that they were just reacting to like his previous surgical at the specialty practices and whatnot. Well, this one on the one side, this lymph node that we were assuming was a lymph node, was just getting bigger and bigger. We're like, all right, you know what? Like, we can't wait any longer. We're going to have to, we need to do something about this. We aspirated it. All we got was blood. So I'm like, we better just either biopsy it or let's just see if we can get it out.
Yeah.
So he came in and we did surgery, and I made an incision over the area and then was carefully dissecting. And after about 3 minutes of dissecting, it was really easy, which isn't necessarily the case with a lymph node because it just seems like it's around with a lot of fat and it's just not as easy. And I was like, this is way too easy. And then I was like, wait a minute. This looks like a testicle. And then I called Carla and I was like, Carla, do you think this is a testicle? And she was like, I think that's a testicle. And I was like, it's a really messed up testicle because it was enlarged and nodular and
oh no.
Yeah. And so I dissected that one down. And then as I finished tying off and removing that testicle, I was like, wait a minute. That bump on that other side, is that a lymph node or is that a testicle? So I went and got the ultrasound machine and ultrasound, and I was like, that is a testicle. So then I went and got that one and removed that one.
Did that one look more like a
That
normal
one was
testicle?
normal. For a dog his size, it would have been normal.
When was this?
Yesterday.
Oh, okay.
Oh, yeah, I was going to say, I remember this dog. That was
Yes.
so crazy.
So,
That is so crazy.
she thought that he had a mass with that inguinal lymph node or
It's just
something.
a bilateral crypt.
Bilateral cryptorchid that
And he's older.
he's like 11. So he's had these forever. And that's one of the things that can happen when they have testicles trapped in warm places is testicular cancer. But we sent that out to the pathologist. So we'll get that back too.
Oh.
That's
So
exciting.
we have
Fascinating.
2 repro histopathologies coming back that we'll have to
Crazy.
update everybody on.
Yeah.
So
That
yeah,
is so crazy. That's cool.
he was hiding those testicles for so long. And he
He
wasn't
didn't want anyone to take him.
I know. He wasn't a
But
big
wasn't
dog.
he tattooed, like marked, neutered?
No.
Owner just
Oh,
probably
okay.
assumed because
They
he
just
doesn't have
assumed.
anything.
And they were, I mean, he's a little dog.
Right,
So his
yeah.
one testicle was only like this big on the other side.
Yeah.
And so,
Should be the word of the day. Testicle.
testicle. So yeah, he couldn't, you wouldn't know that he was an intact male because he's not like, he doesn't have a big head. He doesn't
Yeah.
have,
No.
there's nothing about him that would suggest that he should be an intact male.
And behavior-wise, you said he wasn't doing any.
He's not a,
marking or-
yeah.
He's a little guy.
Yeah.
That's hilarious.
So the moral of the story is don't assume that
Yeah.
that's the
Also,
case.
moral of the
Unless you
story-
see that tattoo, which I
Yes,
did put on him.
the
I was like,
tattoo.
I'm
That's what the
tattooing
tattoo's
you.
for.
Yeah.
A lot of owners ask me what it's
Yep.
for. I'm like, it's really, I mean, you
It's
never
helpful.
know. You really never know sometimes, especially with females. I mean, obviously females aren't as easy to identify.
Absolutely.
But I know it's some of the questions I get are pretty funny.
Yeah.
It's like, how big is it? And I'm like, well, it's just a small.
Can you put my initials?
Yeah, I was gonna say, can you do a shape? Can you make a heart? Which Josie, I'm pretty sure, did. What did she do?
Smiley face.
She did
Yeah.
a smiley face on Casper.
Gosh.
I mean, yeah, it's all funny.
We aren't tattoo artists.
No.
Oh,
we're
no.
not.
No.
But
That would be
basily, we
cool.
will find them.
Yes.
We will find your testicles.
Yes, exactly.
And we
They
will
do
take
not,
them.
they are not born without testicles. If anybody tells you that, it's a lie. Okay. On to our very stirring topic
Yes.
of
Are
finances
we okay, Harrison?
and living
Okay,
with financial responsibilities in the veterinary industry.
Yes.
It's challenging.
Yeah, it is.
To say the
It
least.
is very, very challenging. I feel like, unfortunately, because, and this is what I was talking to my husband about it, and he was like, well, why do you think it is? Like, why do you think you make so much less than your average human nurse? I was like, well, because it's a human nurse. And, people just kind of, and not to say that, I mean, to other people, humans are more important. And with animals, it's just an animal. Like, it's not, I mean, people don't associate animals of having, what's the word I'm thinking of?
Different disease processes.
Yeah,
or-
they're just animals. If my animal's sick, I'm going to take it to the vet. I should spend maybe $100, $200. That's it. And it's just different nowadays, especially with all the like price increasing and the economic world being a little different than it has been in the past, couple years. And I also had mentioned insurance too. In human medicine, most everyone, I should say, has insurance. So you don't see the average cost of a surgery. So if you go in for I don't know.
A tooth extraction.
Yeah, or if you go in for maybe a appendicitis and you don't see the cost of everything because insurance covers some of it. So you pay whatever insurance doesn't cover. Whereas with animals, nowadays, yes, more people have insurance, but it's just not as common. And so you see the average cost of what it is to have a mass removal or a gastrotomy done. And it just looks a lot higher and I think a little more scarier for people too.
Mm-hmm.
But
I think insurance is a huge part of it.
Yeah.
And the availability of, I don't know how that would work with employee compensation and stuff like that, but it's just like what you said, people's willingness to pay for the medical treatment because you're right. They don't see the full picture.
No.
Usually they don't, I guess.
I think what you guys are speaking to is really at the heart of it is the unwillingness of veterinary business owners to charge appropriately. So if you would charge appropriately, then you could pay appropriately.
Yeah.
And I think that's the root of the whole problem.
Absolutely.
And I'll say something controversial, probably going to get a lot of, but you know, somebody had posed a question about affordable veterinary care. What's your definition of affordable? Do you know? And I don't know that it's a right that everyone should have a pet. Like I mean,
Right.
you know,
Right, I
there
agree,
are
100%.
situations where there are corporations or entities that maybe that's their primary objective is to ensure that someone who can't afford to have a pet has a pet, and then they are responsible for those expenses. But for your average business owner, that's not their responsibility. Their responsibility is not to make sure that everyone can have affordable pet care. When you do that, you jeopardize pay scales.
Right.
And so I think that it's really unfortunate that veterinarians aren't willing to charge what they need to charge in order to pay their people well.
Well, yeah, because they worry. I mean, we're all about animals. We care and love for animals, and I think maybe that's why a lot of them don't want to charge full price because a lot of people won't spend it, and they'll end up getting rid of the dog, or unfortunately euthanizing, or just something that they won't want to do because of how much it costs.
And what's sad is that also takes a hit on the medical care and the ability to provide top medical care. Like it truly is, you'll see where they go to a place where they get bare minimum, which is fine, but the animal may require way more workup, treatment, diagnostics, things that where they may end up spending that much anyway by trying to just guess, you know? So it also comes down to just, I don't want to say you get what you pay for type thing, but that kind of is part of it when you have the ability to learn more, to provide more diagnostics, to have more talent in your clinic to be able to do those things. I think it's kind of sad too that people look at our prices but don't appreciate how good the medicine actually is.
What goes into it too.
Exactly.
And how much detail we put into it.
Yeah.
Well, and I want to go back to Allie's thing that she posted on TikTok in regards to the, you know, you said $12 an hour, and people were like, you know, oh, I can't believe you're paying her $12 an hour. It's like, well, that's not what she's currently making. You know, people do grow and develop, and you know, and you had mentioned in your video that was, you know, however many years ago. But I think that the industry is coming around to technicians, especially those that have their credentials, and being willing to pay them more appropriately for could it be better? Yes, it can always be better.
Right.
But I think that there are some things coming down the pipe that will be beneficial for credentialed technicians, like them seeing certain types of appointments like a nurse practitioner and things like that allow them to benefit from, you know, the production type of schematics that veterinarians use as well, you know, which is another way for them to feel like they're being compensated appropriately. But I think that, you know, I think that people are starting to understand that you can't practice, to your point, the type of veterinary medicine that you want to practice without having technicians to help you do that. That you cannot see as many patients. You can't get as much work done. You cannot do nearly as much good if you don't have a credentialed technician, if you don't have a technician. And so I think the industry is starting to see that and starting to pay better.
Yeah.
And, you know, I mean, it's, as with anything in veterinary medicine, it's slow. Everything is so slow to change. But I mean, I feel like it's way better than even when you graduated from,
Yeah.
or
Oh,
you graduated
absolutely.
from
Of
school,
course,
I
yeah,
think,
for sure.
you know.
Yeah.
Well, and what I was telling Allie, or what I was talking to Allie prior to this, is when I started. So the difference between her and I is I went to Purdue.
Mhm.
I did the 4-year program, the bachelor's program, and I knew what I was getting myself into. I knew that Purdue was in-state tuition, usually runs between 18 and 20 grand a year, and I knew that, and I was like, I don't care. I want to go to Purdue. I want to, I want to do all these things. And that's that. And originally went to Purdue to become a vet, decided that wasn't for me, found out they had the vet tech program. So applied for that and luckily got in. And oddly enough, the first thing that they said on orientation day, the supervisor or the vet tech supervisor was, I hope you guys aren't getting in this for the money. And that was I can remember to this day, we're all sitting in the lecture hall and that's the first thing she said. And she said, unfortunately, the veterinary field in general just doesn't pay that much. So you're going to go through all of this and you're not going to get paid that much. And I hope you're okay with that. And it was, we all nodded our heads and we all, we just don't, it's just not something that crossed our minds as far as why we're doing this. We're doing this because we love animals. We're doing this because we want to take care of animals and be a voice for them. We're not doing it to make 6 figures a year. It's just not feasible too. I don't understand why people were getting so upset about getting paid when you're a vet tech, when you should have already known.
You signed up for it.
What you signed up for.
Yeah.
And exactly that's what I'm saying. It's like, I knew what I signed up for. I knew it was going to suck when I graduated. Don't get me wrong. It does suck, but nothing is free. And you're going to have to pay college tuition. And I think that's what people are understanding for Allie is she chose to go to IBC. She chose to work her butt off. She chose to, pay less than me. And so that therefore, when she graduated, she was able to have money in her account and she was able to put money down for a house. It's just a different situation. And we're also, for all of those who commented where you live, we're in Indiana, which is a lot different than California, a lot different than New York, a lot different than Chicago.
Yes.
Your cost of living is outrageous.
Yeah.
So yes, you should get paid more because your cost of living is more. Whereas here, our starting salary was $12 an hour. But
that was 6 years ago. McDonald's is making $15.
Inflation, people.
Yes, it increased. It increased over time. And now, yes, we're making more. Experience. You're not going to graduate and start making $30 an hour just out of nowhere. You have to have experience. And that's also another thing is for those who are just now graduating, don't expect to get paid that much. Expect to work your way up. Especially, and if you want to specialize too, that's how you can make more money as well. If you want to,
I was gonna say specialize.
Yeah, that's another way. So specializing in behavior, neurology, surgery, anesthesia, that'll also increase, your pay as well. But and
that speaks to the listener question, which is that can you go into more specifics in regards to what types of things or specialties to pursue to live more comfortably as a technician?
Yeah.
So I'm not good at saying the at.
You're doing great. It's at.
Okay. That's exactly what you can do. You can pursue the specialty practices.
I was going to say, to the point though, I'm going to challenge a little bit on what you said of don't expect to make a certain amount out of school because we're trying to change the industry and that thought process. Don't also settle either. You have to make a certain amount to be comfortable and for you to be personally comfortable with your lifestyle. So if you go to a clinic, you like them, you sit down, negotiate, start going through that, and it's not what you realistically are no, I can provide this or I need this for XYZ, then it's not the clinic for you because people are going to recognize talent. Talent will then get you further along and obviously get you those pay increases over time. But I think that's part of the problem is we have this mindset in the vet world we just don't get paid much. It is what it is. I'll accept what I can get and know it's going to suck. Try to also have a balance of things have got to change somewhere. So I'm going to start sticking up for myself to an appropriate level.
Oh, right.
And then
absolutely.
see
Try to get as much
what
as you
happens.
can.
Yeah. Because, I
absolutely.
mean,
Well, I
there's
think
not a shortage of jobs.
Right. And I
for
think that
veterinary techs.
you can show if you go in and you have a budget and you're talking to the person or the employer about your budget and why it is, but then show what you can do, like to make a difference. Come in educated from the standpoint of typically what do technicians allow veterinarians to do? How many more appointments can they see per day? Which then allows you to, what's your average client visit, which that's going to generate how much money for you. So in the end, my cost to you, it generates this much more revenue. I think speaking in those terms to those employers, to those veterinarians, that's really, it makes an impact.
Right.
So
That
making your
recognition
case
of your worth.
Yeah.
Because it's such a important part of
Versus
the industry.
an entitlement. Like, I think that you going in and saying, hey, this is what I can do for you. This is the service I can provide for you. And if you do this, this is where you can end up. And you make the case because no one's going to say no.
Yeah.
Prove
yourself.
To those types of,
those people that are go-getters, they're confident, like,
for sure.
Yeah, there's a learning curve when you first get out of school too, but
oh yeah, absolutely.
you just got to be patient and graceful with yourself too.
And I would say, like, do your research. Like, we have so many people from different areas. Like, dig into the area that you're in. I mean, I'm sure there's platforms and things segues that you can go to find information on what, like, typically people are being paid. So I feel like doing your research would be really good going into an interview.
Average
saying,
cost or average pay.
And I think that, when you said that, it made me think there are so many different avenues to becoming a credentialed veterinary technician. And so, whether it be going to a 4-year program like Becca or going to a shorter program like a 2-year program, right? Like IBC or Penn Foster, which our corporation pays for the employee.
Online.
All of them have their pros and cons. But at the end of the day, if that's something that you want to do, then there is an avenue to get you there so that your return on investment is appropriate. So, those are things to be mindful of too, that can help you accomplish the goal and not put you back, because I do think paying attention to the return on investment has to be something that you do pay attention for, because you could love something till the cows come home, but as soon as you can't pay your bills, you're going to hate it really quick. So, keep being mindful of that. Okay. Because everyone gets into that mindset of like, oh, it's just going to be great. I don't care that it's going to cost that much because I love it. Well, that you're not going to love it for very long.
Right. Because it's going to be stressful.
Yes.
And to that point, I think truly like all aspects of when you're finding a job too, the culture, like if you get paid well at that clinic, but you can't get along with anyone or no one gets along.
Oh yeah.
You're going to want to go to a clinic and maybe they don't pay as well, but you have a better life balance.
Yeah.
So it's just to that point of everything. Like you have to pay your bills, but also be happy with what you're doing.
And those specialty, things that you can do to go earn a better wage come with the cons too. If you're going to be a certified anesthetist, guess what? You're going to get called in at 1 a.m. But you're making a higher wage. You can't have both things. I think that's, and that's important. What is it that's more important to you?
Yeah.
And so I think as long as you're having those conversations, with yourself, then I think that hopefully then it doesn't lead to disappointment.
Yeah.
Yep.
Well, and then to answer the question, like when you guys said that living on a vet tech salary is impossible. I mean, I lived on it by myself. I was able to do it. Did I have very much money afterwards? No, I didn't. So, but like I said, it depends on the situation that you're in. It depends on what you're willing to sacrifice and what you're willing to, like, do you want to live on your own? Are you going to have $1 gazillion in student loans? Are you going to, have to pay rent? Or do you want to live with your parents and save up? Or, it really just depends. I was able to do it. Did I have a lot, like I said, did I have a lot of money afterwards after I paid my student loans monthly, after I paid rent? No. But I knew that and I made that sacrifice. And I think that's what people aren't willing to do when they, you want to have a social life, you want to do this, you want to do that. Well, then try to, coordinate, try to save up better. I mean, it really just depends on your situation. Sometimes you can't live alone on a vet tech salary, but you have to figure out how you can. And that's what's really important, especially prior to going into the industry, is figuring out what you need to do to be able to live on your own, especially if you want to. With Allie, she figured it out and she saved up and she worked her butt off and now she's able to do it. So it's just different for everyone. And I think you just have to figure out what part you want to be and where you want to be when you graduate and where you go afterwards financially.
And I would say don't sleep on the pet sitting gigs, man.
Yeah, that's so true.
There's a lot of revenue in that. I mean, yes, it comes at a price, but if you're someone who's young and living at home and you don't have a partner or like a big family type of thing, like that can bring in a lot of revenue, a lot of savings, or I mean, behavior training, grooming. There's other revenues in the industry that you can do.
They all come together.
Side gigs, to come together. I mean, I wasn't just teching when all that happened 6 years ago or whatever. I was pet sitting and doing all these things, and they're great ways to add to your income. So,
What kind of specialties? You had mentioned anesthetists, or I think you can get certified in dermatology.
You can get certified
any
in neuro, ER, anesthesia, behavior,
rehab,
surgery.
So if they find a field they love, I mean, go for it.
I thought very, very hard about specializing in neurology, especially when I worked at VCA, because I loved it so much. But I saw what it took and the amount of time it took, and I was like, you know what? I'd rather not. I'd rather, do this, and I'd rather just kind of relax with not go back to school, one, because I hated school, and two, not put all that effort in because I just didn't really want to. And so it really just depends on where you want to go and how much you want to make and what you're willing to put into it.
Yeah. So it can be done.
But yes, you do make a significant amount, I believe, of more money. But like you said, the hours are not the best. You get overtime, but then again, you're working until 4, 5, 6 o'clock in the morning, and then you're going right back to work 2 hours later. So it really just depends.
Absolutely. I think the whole concept is you say yes to these things means you say no to these things.
Yeah.
And so it's an easy way to think about it.
Yep.
So just know what you're saying yes to, because that's what you're saying no to.
Yes.
The other things.
Exactly.
So, anyway.
Hopefully it touched light on the subject for our listeners, but
yeah, it is. It's just different for everyone.
Yeah.
It really is. So,
yep.
And if we didn't answer your question, hit us up with
Yeah.
another question. We'll come
we
back.
read the comments. So
We can, absolutely. Do another financial podcast.
yeah.
So,
Okay. Shall we?
sure.
Okay. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
All right. Woo woo. Thanks, everybody.
yay.
Take care.